else with questions? No, I will turn it over to Dr. Bocking. Dr. Bocking?
Great. Thanks very much, Sandra. Welcome, everyone. As Sandra indicated, my name is Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit. Although I see all familiar names who have joined us this afternoon, it's nice to see you virtually. So the format of my update will be the same as previous information sessions. I'll start with an update on COVID-19 activity across our region. I'll have some updates regarding vaccination and then some general updates on public health measures related to COVID-19. So to start with an update on COVID-19 numbers or epidemiology across the region. If you follow the provincial numbers, we certainly have seen an increase in COVID-19 activity both across the province and in particular in some smaller jurisdictions that have not previously experienced a significant amount of COVID-19 activity. So this includes areas in Northern Ontario, as well as areas in Southwestern Ontario and in Eastern Ontario. To date, across Haliburton Kawartha Pine Ridge District Health Unit jurisdiction, we have had a total of 2,571 confirmed cases of COVID-19. We currently have 35 active cases, 4 in the County of Haliburton, 16 in the City of Kawartha Lakes, and 15 in Northumberland County. There are 174 high-risk contacts that we are continuing to follow up and monitor. We do have 3 ongoing outbreaks that the health unit is managing. One of these outbreaks is at Campbellford Memorial Hospital, and this outbreak has 7 cases currently associated with it, all among the patient population. There have not been any staff identified to be cases as of yet. There's also 1 outbreak among a school bus cohort in Haliburton County. And then the 3rd outbreak is at a workplace premise in Brighton in Northumberland County. Our incidence rate calculated today is at 18 cases per 100,000. Now, I want to highlight that this is actually double the incidence rate that we reported last week. We have started to see, and I think we'll continue to see, an increase in COVID-19 activity. Our test positivity rate calculated as of last week was 1.5%, and our reproductive number, which is an indication of the number of other people infected with each individual that has an infection, is above 1, which indicates potential for a fairly increased spread among the community. I wanted to flag that to date in this school year, we've had 36 cases identified among the school-age population and staff associated with schools. Other than the 1 outbreak associated with a bus exposure, we have not had any outbreaks at any of our elementary or secondary schools. However, in the last week alone, we have had 12 of those 36 cases identified among school age or staff associated with schools. To me, this really indicates that we're seeing increased activity in a number of different settings, and that we're continuing to see it among younger age groups and school-age children. In the last 14 days, we've had 50 new cases. At 32% of those do not have an identifiable source of transmission, 20% identified to be household contacts, and 16% of those cases identified to be close contacts. When I look at our neighboring health unit jurisdictions, we see significant increases in COVID-19 activity, both on our west side as well as our east side. I do think that we have fared quite well in comparison to date with our COVID-19 activity. However, we are starting to see an increase, and I think we should expect to see a continued increase over the next couple of weeks. And I'll speak in a little bit about some of the public health measures that I really am going to continue to encourage people to implement. The other big news, provincially, nationally, globally, associated with COVID-19 activity is the identification of a new variant of concern that has been called or named Omicron by the Greek alphabet by the World Health Organization. So on November the 26th, the WHO declared this a variant of concern and labeled it Omicron. It was identified by scientists in South Africa. It is quite likely that this variant had been circulating for several weeks, both in South Africa as well as other countries, before being fully identified. What's concerning about this variant is the number of mutations that have been identified in its genomic sequencing and its analysis. So there are greater than 50 mutations as part of this variant. And some of these mutations are the same as mutations that have been seen in other variants of concern. For example, the Delta variant and the Alpha variant. And this is what has led to, I think, the global concern and heightened awareness about this variant. There's not enough data as of yet to confirm the public health implications of this new variant. Right now, I think we're on heightened awareness and waiting to see how this variant compares in terms of how infectious it is, how easy it spreads from person to person, waiting to determine what the severity of disease is associated with this variant, and waiting to determine what the effectiveness of our current vaccines are with regards to this variant. There is some indication from those countries that have identified a high number of cases, such as South Africa, that this variant is likely equally as infectious and possibly more so than the Delta variant. But again, it's too early at this point in time to make any conclusions as to what the public health implications are from the variant. But there's enough information to, I think, have heightened awareness and be taking appropriate precautions in response. I'll move now to a couple of updates just regarding vaccination. So in terms of progress across all of Haliburton, Kawartha, Pine Ridge District Health Unit, among the population that is age 12 and over, 86.9% have received one dose of COVID-19 vaccine, and 84.4% have received 2 doses and are considered to be fully vaccinated. We do continue to see a very small incremental increase in the number of people aged 12 and over that are still getting their first dose of vaccine. And I continue to encourage anyone that has yet to be vaccinated, that is eligible to be vaccinated, to please go out and get your first dose of vaccine. Vaccination continues to be the number one preventative measure that we can take right now as an individual and as a community to help prevent the spread of COVID-19 and help prevent the severe outcomes associated with COVID-19 that we see, especially among our older population. With regards to third doses and booster doses of vaccine, current eligibility has remained the same. So for individuals eligible for a third dose are those with moderate and severe medical conditions that result in their immune systems not working as well. So for example, people undergoing treatment for cancer. This category of individuals is expanding and continues to expand as the Provincial Vaccine Clinical Advisory Committee continues to review all of the data and evidence regarding third doses in this population. So for that group of individuals, if it has been 2 months since the second dose, they're able to get a third dose of vaccine to bring their immune levels up to really the same level as the rest of the population after they had received 2 doses. The other group eligible for booster doses are people that are age 70 and over, or born in the year 1951 and earlier, healthcare workers, including essential caregivers, Indigenous peoples, so First Nations, Inuit, and Métis populations, as well as individuals that had received a full series of the viral vector vaccine. So that would be if you had 2 doses of AstraZeneca vaccine or 1 dose of the Johnson & Johnson vaccine. These individuals are eligible. They can get a booster dose of an mRNA vaccine once it has been 6 months from their 2nd dose of vaccine. And then, of course, big news, lots of discussion about is the rollout of vaccines for children between the ages of 5 and 11 years old. So a couple of reminders. This is the Pfizer vaccine that has been approved and licensed for use in Canada by Health Canada for children aged 5 to 11. The vaccine is a smaller dose, so the pediatric or children's dose of vaccine is 10 micrograms compared to the 12 and over dose, which is 30 micrograms. It has a slightly different buffer than the adult dose, which is actually improved some of the transportability and storage of the pediatric or the children's vaccine. In terms of rollout in Haliburton, Kawartha, Pine Ridge, so the province, we received vaccine late at the end of last week. Our first booked appointments were available starting Monday of this week. And as of this morning, over 1,000 residents aged 5 to 11 residents of Haliburton, Kawartha, Pine Ridge District Health Unit had already received their first dose of COVID-19 vaccine, which is really, really exciting news. Families and children are able to access COVID-19 vaccine through a number of different ways. One way is at health unit-led vaccine clinics. You can book an appointment for these vaccine clinics on the provincial booking system. There are over 8,000 appointments available for children aged 5 to 11 throughout the month of December. We know that right now there's over 2,000 appointments that are currently booked. And so there's still a significant number of appointments that are open and available for children and families to access vaccine throughout the month of December. In addition, there's many primary care practices that are also offering COVID-19 vaccine. In particular, in Northumberland County, we know a number of the family health teams, as well as community health centers, are offering vaccine clinics for their pediatric population or for the population aged 5 to 11. Also, there's at least 16 pharmacies across all of HKPR jurisdiction that are also offering the COVID-19 vaccine for children aged 5 to 11. And so parents and guardians can connect with their local pharmacies to determine whether or not that's the channel that they would like to receive vaccine. Many different ways to access vaccine. I think the other key thing to note is there's a lot of questions. I think a lot of information circulating on the internet, on social media about COVID-19 vaccination for children. I think it's normal for parents, guardians to have questions about newer products for children. And parents and guardians want what's best for their children and want to keep children safe and healthy. There are a number of sources that have very good information about COVID-19 vaccine in children, about its safety, about how well it works. This includes many resources listed through our website that might connect you to resources from the Hospital for Sick Children, the Canadian Pediatric Society, the pediatric section of the Ontario Medical Association. All have developed really, I think, thorough and thoughtful resources that provide information about COVID-19 vaccine in children. So for parents that have questions, I'd encourage you to connect with your trusted healthcare providers and to speak with them, to visit sites on the internet, and of course, sites on the internet that are linked with some of these public health resources or pediatric society resources. And then, of course, the health unit is hosting a panel discussion tomorrow evening, December the 2nd, on COVID-19 vaccine in children aged 5 to 11. So myself will be on the panel, I have 2 local family physicians, as well as one of the public health nurses from our team at HKPR. We'll be talking about the safety data behind the vaccine, efficacy data behind the vaccine, different strategies we can use to help children in receiving vaccine and making sure that it's a safe and positive experience for everyone that's involved. Otherwise, for other booster doses, third doses, appointments are also available through the provincial booking system. We do continue to accept walk-in clients for immunizations during the last hour of our clinics, so between 3:30 and 4:30. If you don't want to book an appointment, you can come in. Also, again, greater than 40 pharmacies across the region supporting adult immunizations for COVID-19. So lots of opportunity to ensure that you are as protected as you can be against COVID-19. So I think in closing to my update, I've certainly been asked a couple of times regarding advice as we enter the holiday season for social gatherings. And I think what I want to really emphasize today is that the individual and community choices that we make today regarding preventive measures we take for COVID-19 is what's going to determine our caseload in a couple of weeks from now. Right now, we know that our cases are increasing. We're seeing more outbreaks. We're seeing more cases among elementary school children and associated activities. And if we continue with all of our same behaviors right now, we're going to continue to see these cases go up. So we have an opportunity before our numbers continue to rise significantly to start to reevaluate some of the day-to-day behaviors that we have. So this means that if you're feeling sick, that you're staying home, that you're not attending school, not attending work. If you're able to work from home, that you work from home. That if you're feeling sick and you have symptoms of COVID-19, that you get tested. I think that there's likely virus circulating in the community that we're not seeing because people are not being tested. And there's certainly access and opportunity to get tested so that people are able to make informed decisions about the types of activities they're doing. If you're out in public, that you're wearing a mask. If you're in indoor gatherings with individuals that are from outside your household, that you're wearing a mask. And that when you're participating in social gatherings, you're aware of who's attending. And if there are individuals that are not vaccinated, that people are wearing masks to protect really everybody that's participating in that gathering. And that we're keeping our gatherings smaller at this point in time. I think the more we see kind of larger gatherings and opportunities for virus to spread, we'll continue to see the virus to spread. And I think I'll end there and happy to take any questions as usual. And I hope everyone's doing well and looking forward to discussion. Thank you.
Great. Thanks, Dr. Bocking. Lots of good information as always. And I see the first hand that we have up is actually Dan. So Dan, do you want to go ahead?
Yes, thanks, Chandra, and Dr. Bocking as always. I know last week you mentioned that some of the highest, or one of the highest case rates per population was the school-aged children, I guess. So what are some of the factors that you think have sort of impacted that? Is it, the effectiveness of the vaccine, or are there others as well?
Thanks, Dan. So I think COVID-19 activity among younger children and among school-age children is still a reflection of COVID-19 in the community. So we're not necessarily seeing a lot of spread within schools, but there is sufficient COVID-19 activity in the community that we're seeing more cases among schools. I think one of the biggest pieces associated with that is that young children, elementary school children in particular, have not been eligible for vaccination. So those other settings where we used to see a lot of outbreaks, we're not seeing the same number of outbreaks likely associated with vaccination. I think certainly as we roll out vaccination and offer vaccines to younger ages, that we'll start to see decreased transmission and then decreased activity among that age group as well.
Okay. Yeah, I guess what can parents or schools do to sort of help protect children and maybe discourage gatherings, I guess, as well?
So I think one of the most important things remains to be vaccinated. And if you're not quite comfortable yet with the pediatric vaccine that's available, that you ask your questions and that you gather the information that you need to become comfortable. I think we'll certainly still have lots of discussion about this in the upcoming weeks. I know that schools are really continuing to be quite vigilant with regards to COVID-19 activity. And I'd encourage parents to continue to be really vigilant, especially with screening, so that if kids are sick, if they have symptoms, they're not attending school, they're staying home. That you're limiting really the number of different types of gatherings that you're attending. Your kids might be involved in maybe one extracurricular activity, but the more different gatherings and different types of activities that families engage in, the more opportunity there is for virus to spread. And I think certainly testing if people have symptoms are all really important. Kids are really good at following the rules and following public health measures to the best of their ability. So certainly we're continuing to see kids that are masked in schools, lots of hand washing, and all of those basic public health measures. So I think we can continue to, positive reinforcement for kids in all of the work that they're doing to keep each other healthy.
All right, that's perfect. Thanks.
Great. Thanks, Dan. I have Sarah next. Sarah, do you want to go ahead?
Hi, thank you for the update this week, Dr. Bocking. I'm going to start to focus with outbreaks. I guess first, we have heard, I know you mentioned there's 3 ongoing outbreaks. Is there also a new outbreak declared at the Lindsay Central East Correctional Center location again?
So not to my knowledge. I mean, it's possible that the team was looking at something today, but there has nothing that has come to my attention as of yet. So certainly after this call, I can double check. I know that we were monitoring some activity, but I am not aware of an outbreak that has been declared today.
Okay, I'll drop a quick line just with that after we sign off here. And then, so the 3 ongoing outbreaks, I think you mentioned 7 cases associated with Campbellford Memorial Hospital. I'm wondering, we have 2 other, Halliburton and the Brighton Farm. Are you able to provide some additional numbers in those instances? Thank you.
Yeah. So with the workplace exposure or farm outbreak, I understand that there's 3 cases associated with that outbreak, and with the outbreak declared with the school bus cohort, I understand that there are 3 cases identified as part of that outbreak.
Thank you, Dr. Bocking.
Okay, that's great. Then I have Katrina. Katrina, are you?
If you're talking, you might be on mute.
Yes.
Oh, can you hear me now?
Yes, we can hear you now. Thanks.
There we go. Sorry about that. And I do apologize. I logged on a little bit late. I got tied up and I heard just the tail end about you talking about the new Omicron variant. So I apologize if this was already addressed. but with the travel restrictions that have been put in place now, do you think that will contain the spread? Have we done enough, or do you think it's only a matter of time until we see that variant in the HKPR region? And I guess, what are your concerns when it comes to that?
So I do think that it's a matter of time before we see increased cases associated with this variant. I think we were in a very similar situation a couple of months ago with the Delta variant. And what we've seen is that the more opportunity there is for COVID to spread, these newer, I don't know if stronger is the right word, stronger variants kind of become the dominant variant. And so it's likely over the next couple of months that Omicron could become the dominant variant, the same way that Delta variant became the dominant variant. I think right now there's a number of things that we're waiting to just have more data about, more information about. We need to know how much more infectious the Omicron variant is. We need to know whether or not it causes the same severity of disease as the other variants or the original virus, and then of course how well the vaccine works. I think we're not starting at square one with Omicron. We have good experience in containing variants. We know this is still the same virus. We know how it spreads. We know what measures work. And even if the vaccine is not as effective against this variant as other variants, there will still be some protection, and will still be, I think there's technology available to start to adapt vaccines as needed for protection. So while it's concerning, I do think we know some of the basic principles that to be able to contain and prevent transmission from this variant, and we'll just have to continue to be vigilant in all of our practice of different public health measures.
Okay, thank you so much. And I apologize since that was probably addressed earlier. My next question is about the pediatric vaccines. I'm wondering if we know how many kids in the region between that 5 and 11 age group are eligible to get the vaccine.
So we do. It's just over 11,000 kids that are between aged 5 and 11 across all of our 3 geographies.
Okay. And is there a goal as to how many children you would like to see vaccinated? We've heard about that 90% when it comes to those 12 and over. So is that the same goal for children?
So the province, as of yet, has not come out with a target number for this age group in particular. We know when new vaccines have been introduced before, historically, that parents in general are more cautious. They are cautious with their children, and so I think we're not expecting to reach 90% right away, that it will take a little bit of time for parents and guardians to feel really comfortable with this vaccine and see how it's rolling out. We've certainly made sure that we have sufficient capacity within all of our clinics to accommodate 70 to 80% of that 11,000 children. But I think at this point in time, we're not setting one specific target number.
Okay, thank you, Dr. Bocking.
Sorry, you got the really long answer.
That's okay. Longer is better than not enough details, so I appreciate it.
Okay, that's great. So looks like we've got a second round of questions from Dan and then Sarah. So Dan, do you want to go ahead?
Thanks. Yeah, just staying on the pediatric vaccine for a moment. So is the waiting period between doses the same as it is with other age groups?
So the time period between first and second dose for the pediatric vaccine is 8 weeks. For 12 and over, the National Advisory Committee on Immunization has now recommended that there be 8 weeks in between first and second doses. The product monograph, or the manufacturer, has said that the interval could be as low as 21 days. So many people, especially those people that are requiring proof of vaccination, either for employment or for other reasons, might choose that shorter window to to have that full proof of vaccination. But in kids, we are waiting the entire or the full 8-week period and not offering it at the manufacturer interval at this point in time.
Okay, that's great. Thanks.
Just going
Okay.
to, sorry,
Sarah,
sorry.
go ahead then.
Okay, thanks. Sorry. Just building off the kids' vaccine and just doing quick. So about 11,000. You said we already had 1,000 booked, or 1,000 done, 2,000 booked, and then I think I heard 8,000 available appointments throughout December. So hypothetically speaking, with those numbers, could HKPR have all first doses pending eligible? Could technically that population receive their first doses by end of year? Is my question. Thank you.
Yeah. So we have capacity across the region for every 5 to 11-year-old child that's eligible to receive their first dose of vaccine. And that's capacity not just at the health unit, so lots of capacity at health unit clinics, but also with primary care teams, and then also taking into consideration pharmacies, more than enough capacity to support this rollout among 5 to 11-year-olds.
Thank you.
Okay, great. Thanks, Sarah. I'm just looking here to see if there's any additional questions. Anybody want to sort of add in the next round of questions? Any further questions from anybody on the line? Just going once. Going twice. No, I don't see any other hands up, Dr. Bocking. So that may be the end of the questions. So if it is, I'll thank everybody for, once again, lots of good questions, lots of good information shared by Dr. Bocking. Always so many things to discuss during these sessions. So thank you to everyone for participating, and thank you for your help in getting this information out to our residents. Always a big help with that. And with that, I'll say good afternoon to everybody, and thank you again. Take care.
Thanks very much. Take care, everyone.